Hello, and welcome to the course on medication administration presented by Corey Roman, registered nurse. Our course objectives for today include to be able to identify the purpose and importance of this course, define medication therapy, medication cycle, identify the 8 rights of medication administration, discuss the purpose of the MAR or MAR, discuss chemical versus brand name, and to review the administration procedures and techniques. We are also going to discuss how to handle controlled substances, how to handle when a resident refuses their medication, identify how to chart a medication error, discuss procedures for verbal and PRN medications, and we are also going to discuss the proper procedure for when a consumer is away from their primary residence. This medication administration course is broken up into 3 sections. The first section will be a lecture session in which we will go through this particular presentation with a PowerPoint. This section will take about an hour. The next section to this course is your skills checkoff and return demonstration, which you will need to review pages 21 through 40 in your packet prior to the skills checkoff date. It is important that you review this information, you write down any questions that you may have about a particular skill, and you bring these questions to your skills checkoff session. During this section, there's actually a form that I will complete, and I will make sure that you feel comfortable passing a medication prior to me giving you a passing grade on this particular section of the skills checkoff. The skills checkoff will also be followed by a written test. There is 3 versions of the test. The test consists of 25 questions, and this includes multiple choice, matching, true, false, and fill in the blank. This test is also closed notes, and you cannot work with a partner on this test, and you must make an 80% or above on this test to pass it. So the medication administration course requires you passing 3 parts. 1, you must review this video in its entirety. 2, you must do well on your skills checkoff. And 3, you have to pass a written test with the 80 or above. This course is for unlicensed personnel in community facilities. It provides basic information on proper medication administration. Again, this course is for unlicensed personnel, and it ensures the competency of staff members who administer medications to individuals in community facilities. Medication administration is a serious responsibility, and you are responsible for the medications in which you administer. So this course will minimally prepare the unlicensed personnel to administer medications by certain routes. And the routes that will be included in your skills demonstration may be PO or by mouth, ear, eye, as well as putting on patches. This course will not certify, license, or register you, and the credentials obtained in this course cannot be transferred outside of the employing agency. And again, you must make at least an 80 on the written test to pass the course. So the course is composed of 3 different sections. It's the section where you get the information through this PowerPoint presentation. And then there is a skills checkoff and return demonstration. And then there is also a written test. So once each of these 3 components have been achieved, then that's when you will be considered able to competently pass medications. Medication therapy. The definition of medication therapy is the treatment by the use of substances that cure, relieve, prevent, and diagnose disease. Medication therapy is usually to relieve the disease rather than cure the disease. And now society has shifted towards a preventive type therapy versus actually using medications when possible. So let's say, for instance, you have a patient who has high blood pressure. They will take an antihypertensive, and that's a medication that will help reduce their blood pressure. It's not really going to cure the disease itself because underlying the individual still has high blood pressure, but the medication will help bring the blood pressure down. Now, that's not to say that a person taking blood pressure medication can never come off of their blood pressure medication, because with diet and exercise, that can be possible. But it's just saying that without those things and just relying on medication alone, it's not really going to cure the disease. What it's going to do is treat the symptoms, and in this case it would be high blood pressure. Our medication cycle. The medication cycle includes 5 components, and that is prescription, dispensing, administration, documentation, and observation. The prescription is done by the physician or the physician extender, and a physician extender may include a nurse practitioner or a physician's assistant. The dispensing is done by the pharmacist. So your responsibilities is to administer the medication, document that you gave the medication, and then also observe for side effects and document those as well. Again, I can't stress it enough. Medication administration is a serious responsibility, and therefore you should take this very seriously. So now we are going to look at the 8 rights of medication administration. So the next section will be broken down to going over each right, and I like to play the Jeopardy game here. So the 8 rights of medication administration includes the right patient, the right dose, the right route, the right time, the right medication, and the right documentation. So here we're going to review those 8 rights. Also included in those rights is the right to refuse and the right to be educated. So that's how we make up our 8 rights of medication administration. First question, how do you identify that you have the right patient when passing medications? To ensure that you are abiding by the to ensure that you're abiding by the right patient, you have to ask the patient their name or date of birth, and then also you need to have a photo of this individual found with their MAR. This is how you identify you have the right patient. Now, in your patient population, they may not be able to verbalize their name and the correct date of birth. So you may rely on the picture. If depending on the setting that you work in, there may be a room number associated with their patient. There may be a medical record number on an armband associated with that patient, but you do have to identify the patient. And typically we say you have to have 2 patient identifiers. So typically the name and a photo ID would be appropriate, or the name or date of birth would be appropriate. The point is that you identify the patient before you give them the particular medication. Where do you locate the name and date of birth? This is found on the MAR, or the Medication Administration Record. And this information should be legibly written, and you should compare this to when you're actually talking to the patient to verify they are who they say they are and you have the right chart in front of you. How up to date should the photo be? Photos should be taken on a yearly basis. And this is just to ensure that you have an up-to-date photo so that the patient actually resembles the photo. We know we all change from year to year. We lose weight, we put on weight. Another good reason to make sure that you have an up-to-date photo is because, say, if your resident wanders away from the facility or wanders away from the home, you actually have a photo there that you can show to authorities in hopes of somebody being able to identify this particular resident. So again, you want to have up-to-date photos, usually taken within the past year. How many times do you need to make certain that you have the right patient? The magic number here is 3, and you check this when you pull the medication from the drawer or from the dispenser, when you are preparing the medications, and even after you give the medications. So you need to do 3 checks to make sure that you have the right patient. There is nothing more dangerous than giving a patient the wrong medication. And why is identifying the right patient important? Why talk about this at all? And basically, it's because it ensures that we are administering the proper medication. It is important to give the right medication to the right patient, because if you give the wrong medication, you could cause death in a patient. It could be an adverse reaction, or they could even have anaphylactic shock. Anaphylactic shock could result in death because it's going to decrease your heart rate, it's going to cause your throat to swell, so you're definitely going to have some trouble breathing. So that's why this right is very important. You always make sure you have the right patient. Our next right is the right dose. So how do you know that you have the right dose of medication? Again, you want to look at your medication administration record. You should consider your medication administration record the Bible when it comes to administering medication. That MAR tells you everything about that patient. It tells you the name of the medicine, the dose of the medicine, how much of the medication the patient is to receive, when they are to receive that medication. And it has other information on there, like drug allergies, the name of their doctor, and the name of their pharmacy. But you want to review the MAR 3 times to ensure that you are given the right dose of medication. We need to also pay attention to the strength of the medication that's written, because on the MAR it may say metoprolol 50 milligrams, give 100 milligrams daily. And it also needs to then say give 2 tablets, because if 1 tablet is 50, you're going to have to give 2 to equal the dose of 100. So that's why you have to pay close attention to the number of pills that you're given. Pay attention to the amount of medication that they're supposed to get, because the MAR may say put 2 drops in the right eye and 1 drop in the left eye. So you really have to pay attention to what your MAR says, and then also compare it to the actual medication, and they should match. What is TSP? TSP means teaspoon, and in your packet there is a larger form that basically goes over all of your abbreviations. So if you turn to page 45 in your packet, there is a list of all abbreviations. You need to make sure that you look over those abbreviations, because for testing purposes you are going to see some of these abbreviations again. TBSP is tablespoon, so try not to get those confused. These abbreviations could look to some like Greek or Spanish, because some of these abbreviations really may not match what you actually think it is. So you just need to keep practicing these, make flashcards if you have to, get with a study partner, and just keep reviewing these, because that's the best way to learn them, just repetitively going over these. What is GTT? GTT is drop, and this is the prime example where looking at this abbreviation, it would not automatically cue you into it means drop. So again, you really have to study these and look at these. Also, whenever it refers to the ears and the eyes, those can be confusing as well, but once again, it just takes repetitive studying. Why is the right dose important? Why is this right important? And basically, it helps us to prevent underdosing or overdosing of medication. We have to think the doctor prescribed this medication at this dose for a certain reason. Some patients or some medications are based off of weight. So depending on your weight, that's going to determine how much medication you get. And that's one reason why we have to make sure we're given the right dose. So I can't stress how important it is to make sure you're looking at the number of pills, the amount of drops, the amount of liquid that this patient is getting. And don't assume because the order says low pressure 50 milligrams that you only have to give one tablet, because if those are 25 milligram tablets, you're going to have to give two tablets. That's why on the MAR, that's how it should be written. Give two tablets, PO, by mouth, QD, which is daily. Again, the abbreviations, just keep studying those. Our next right is the right route. And what does route refer to? And some people pronounce this as route, some people pronounce it as route. But basically, the route refers to the area in which the medication will be given or the medication will be applied to. So an example of an internal route would be PO, which is by mouth. This is the most generalized route there is, and medications typically work within 30 to 45 minutes if you give it PO, but that time frame will depend on if it's a slow release capsule or if it's an immediate release capsule. So that's going to determine how fast the medication is absorbed by the body. But PO means by mouth. It's the most generalized route and typically is the cheapest route. It's also the most easiest to administer as long as you have a cooperative patient. What does PR mean? PR means by rectum. Again, one of those abbreviations that you may see, and unless you study it, initially you may not know what PR means. So again, refer back to your abbreviations on page 48. What does NPO mean? NPO means nothing by mouth, and typically you are going to see this when your patient has surgery or when your patient has been scheduled a surgery, and typically the order will say NPO after midnight. We just have to make sure that we get specific instructions from the physician, because sometimes it may say NPO except for this particular medication. So that means that you will still give that medication as it was prescribed, but you're going to hold all other medications. And typically when they're NPO, it also means nothing to eat or drink. So not only does it refer to medications, it refers to food as well. So again, you need to get clarification from the doctor if they want exactly what do they want to be held from this particular patient. Also, not only surgery, but lab work. Say, for instance, your patient was going to get their cholesterol drawn in the morning. That's typically something that they fast for, and they will be NPO after midnight for those labs. Where do you find the right route, and why is it important? You find the route on the MAR, and it's important because it has to have the right effect. You don't want to give a patient insulin by mouth versus in the skin, because it's not going to absorb and it's not going to help with their blood sugar. So therefore, if we want the right effect to occur, we have to give the medication by the correct route. You also could cause some serious illness if you mistakenly give an eardrop and put it in the eye. So we have to make sure that we're looking at the MAR, we're looking at the medication, and that they match and that things actually make sense. So we want to prevent a reaction from occurring. And again, not all medications you're going to be able to give by mouth. Some medications will be in a patch. Some of it may go under the tongue. Some of it may absorb on the skin. It just depends on that particular type of medication. You should also not give medications by routes in which you have not been checked off to do. So, say for instance, if your patient did have insulin, if you haven't been checked off to give insulin or give any type of shots, you should not be doing that. You need to refer that back to your supervisor, and other arrangements need to be made for that patient to be able to receive that medication. The right time. What is the time duration that a medication can be given? The rule here is 1 hour before the medication is due and 1 hour after the medication is due. So let's say, for instance, you have a patient and their medication is due at 9. You can give it as early as 8 or as late as 10. My advice is do not get into the habit of giving a medication late all the time. You should try to give it at the designated time because some of these medications are time sensitive. So that means if we're constantly giving it late, the levels are dropping. So let's take a medication, for example, Dilantin. Dilantin is a seizure medication. If you continuously give that medication late, the levels is dropping. The levels get too low, it could result in that patient actually having a seizure. So once again, it's important that we give the medication at a time that it's due, and we also know that things are going to happen, things are going to come up. So sometimes we may have to give it a little bit early, but no more than an hour before, and sometimes we may have to give it a little bit late, but no more than an hour late. If it's a daily med and you're more than an hour late, you probably need to call the physician and get special orders to give it late, because sometimes medications have reactions to one another, and you don't want to give it late with another medication and then the patient develops a reaction. If you give a medication more than an hour late, you need to write that on the back of your MAR, what time you gave it. So if it's due at 8 and they didn't get it till 10, you need to be writing that on the back of your MAR. How do you know what time a medication is due? Again, you refer to your MAR. There should be a column there on the MAR for time, and it should specify the times that a medication is due. Why is it important that medications be given at the designated time? And I kind of covered this earlier. And basically, it's to maintain the correct amount of medication in the body. What does the following stand for? QD, QHS, QOD. QD stands for daily or every day. QHS stands for bedtime or hour of sleep. QOD stands for every other day. Again, study your abbreviations, refer to page 48 if you have any questions. What does BID, QID, and TID stand for? BID, twice daily, think of bi. QID, 4 times daily, think of quad, has 4 sides. And TID, 3 times daily, think of a triangle, again, has 3 sides. Right medication. Why is the right medication important? The right medication is important because we want to make sure we're having the right effect or the desired effect. And the desired effect is what we want the medication to do, the purpose of the medicine. So earlier I gave you an example of an antihypertensive. The purpose of that drug is to bring down the blood pressure. The wrong medication could have an adverse effect, or it could cause death or disability. Again, a prime example, say if you give insulin to a patient who there's nothing wrong with their blood sugar. Their blood sugar is then going to drop, and it can cause them to potentially go into a coma or even die. Therefore, it's your responsibility to know the specific purpose of each medication that you are about to administer, because it's your responsibility. Be sure that you check drug allergies prior to administering any medications. Again, drug allergies can be found on the MAR. And with any medication, there is always side effects. So once again, we want to check allergies, and we also want to know what's normal for a particular medication. I gave you an example earlier of Dilantin. Well, Dilantin is for seizures, as I said before, but this medication can also cause the urine to turn orange. So that's a side effect that's normal, but you need to know it, because otherwise you're going to be frightened when you go and a patient's reporting that their urine is now orange. You also need to know that when a patient takes more than one medication, that can lead to a reaction. So again, your job is to observe and document and also report. So if you notice that your patient is broken out in a rash after taking a medicine, you want to report that to the doctor. Also, on the bottles of medications, there's labels. Those labels are not there just to make the bottles pretty, they're there for a reason. So some of these labels may say stay out of direct sunlight. Some of these labels may say Do not operate heavy machinery while you're taking this medication because it could cause drowsiness. So, again, it is your responsibility to observe and report any side effects. How do you know you have the right medication? Again, you're going to review your MAR, compare it to the medication labels, and again, you're going to do this 3 times. We talked about drug allergies a minute ago. Keep in mind that all reactions to a medication does not mean you have a drug allergy to it. Some medications, again, is just a side effect. Let's say, for instance, morphine. Some people will say, well, morphine makes me itch. That's actually a side effect of morphine versus an allergic reaction. Now, if a patient was to say it makes me itch, I break out in a rash, and I have trouble breathing, that's pretty much an allergic reaction, and they probably should not have that medicine. But if it only leads to itching, then we can help that out. The doctor can prescribe Benadryl and they can still have their morphine. So it's important that we know not only what they're allergic to, but what happens when they take the medication. Therefore, the doctor can determine, is this a true allergy or is it just a side effect of the medication? There's a big difference between the two. What does the following stand for? TAB, SUSP, ELIX. TAB is tablet, SUSP is suspension, and ELIX is elixir. Different forms of medication. And also with the suspensions and elixirs, pay close attention if it says to shake before administering, which typically any liquid you're going to shake before you administer because the particles will settle to the bottom. And then if you give that without shaking it, chances are you're not giving the patient the right dose of medication. So again, pay attention. SUPP stands for suppository, SYP stands for syrup, GTT stands for drop. Let's say you have medications that are non-prescription, so over-the-counter medications. These medications need to be stored in the original manufacturer's label. It should also have the expiration date on the particular bottle. So let's say your patient has an order for Tylenol. Tylenol is over the counter, therefore it does not require a prescription. It needs to stay in the Tylenol bottle itself. When do you sign off that a medication has to be administered? And this is under the right documentation. You do not sign off on a medication until after you have given the medication. You never pre-sign. You always sign off after you give it. You place your initials in the appropriate box, and that indicates that you have actually given a medication. How do you indicate a medication was not given? You do this by looking on the back of your MAR, looking at the What is the correct procedure for a patient being out of medication? If a patient is out of medication, we need to call a refill into the pharmacy, and it should be documented that we've called in for the refill. A patient should really never run out of medication, because when they get down to a week's worth of medicines, we should be then calling in the refill. You should not wait until their days out, 1 or 2 days left, because if that pharmacy doesn't have that medication, or if it's a specialty ordered med, it's going to be a while before it gets back in stock. And we don't want our patients to be without their medications. That could definitely result in a side effect that we don't want to occur. The MAR is a what type of document, and it can be used in the court of law. The MAR is a legal document. So again, if you refer to pages 42 and 43 in your packets that you've been provided with, it kind of goes over the MAR. The MAR should only be written in black ink, and it should be legible. Again, this document is compared with the medications 3 times before the medication is even administered. On the MAR, you should have the patient's name, the patient's date of birth, the doctor's name, any drug allergies, their diagnosis, and then each medication should be a complete order. So you should have the name of the medicine, the dose of the medicine, how often they're taking the medication, and by what route they're taking for the medication. And it's also nice to have what the medication is in parentheses as well. So again, this refers to pages 15 and 16 in your MAR. And it also refers to pages 42 and 43 of your packet as well. You have a separate documentation class, so in this presentation I'm not going to go a lot into documentation, but what I will point out is that on pages 42 and 43, it's a good example of what an MAR should look like. Your MAR should tell a story. So for example, your patient was on Coumadin. On the 7th, 9th, and 11th, they circled their initials. So that means that the patient did not get this medicine for some reason. If I look on page 43, I see where this person has written that their Darvocet was for right leg pain. But I also see where the Coumadin was not available, and they called the pharmacy on the 7th. The Coumadin was not available on the 9th, so they called the pharmacy and the physician. And then the Coumadin was not available on the 11th, so they called the physician and the pharmacy again. It tells a story. So this person would be covered if the state were to come in. Now, Coumadin is a blood thinner. So if your patient does not have their Coumadin like they're supposed to, that could lead to blood clots. Then they can be at risk for a stroke or a heart attack. So this is not a medicine that it's okay to miss. Really, no medication you should be missing, but especially a medication like this. So I see that this person did make the necessary phone calls to get that medication. Also on your MAR, if you look at Darvocet, that's a PRN medication. So in a little bit in the presentation, we'll talk about PRN, but that just means that they take it when needed or when necessary. So I see that they gave this medication on the 3rd and the 9th. I look on the back of my MAR, which is page 43, and the 3rd I see they gave it for right leg pain, and it was effective at 12. They gave it at 10. And then I look down on the 9th, they gave it for right leg pain again. They gave it at 10. It was effective at 11. So anytime you give a PRN, anytime you circle off a med, anytime a med is late, you need to write it on the back of your MAR. Again, your MAR should tell a story, and it should be legibly written, it should be clear, and it should be easy to follow. Your MAR is a legal document. Right documentation. How do you record a medication error on the MAR? To record a medication error, you will draw a single line through the arrow, time, date, and initial that medication error. If there's enough room, you'll continue to write out the medicine, or if you have to go to the next line, you'll just write, see below. Go to the next line, write it neatly. There's no need to scribble. You do not use whiteout. You do not write in pencil. You draw a single line. Therefore, if you're ever called into the court of law, you can still read what you wrote. So that's why you don't want to scribble out or mark out. It's just one single line and then you initial. As I said earlier, your patient does have a right to refuse their medications. So in this case, what do you do if your patient refuses his or her medications? You want to wait 5 to 10 minutes and try it again. Another option is to get someone else to try. And for repeated refusals, you want to notify your supervisor. You do want to document appropriately. You can never force a patient to take their medications, so that means you can never hide it in applesauce. And individuals, again, they do have a right to refuse their actual medications. Our responsibility is to let the patient know what could happen if they do not take their medications. And this could be as simple as, Mr. John, this is your medication. If you do not take your medication, let's say the medication is for seizures. If you do not take your seizure medication, it could cause you to have a seizure. You do want to try 3 times though, and you can try different techniques each time. But what you'll do is if they refuse on the 3rd time, you turn to the back of your MAR, like we talked about on page 48, and you document patient refused times 3. And that lets the evaluators know that the patient refused their medications and that we tried actually 3 times. And excuse me, that was actually page 43 of your packet where you have your MAR. So you do want to document appropriately. Now, if your patient keeps refusing the same medications every day and you're circling it off, we need to let the supervisor know and the physician knows. And we need to kind of evaluate why the patient's not taking it. Maybe they're not taking it because it's hard to swallow. Well, this medication could come in a liquid form. That would help eliminate that. Or maybe the medication doesn't taste good. Well, if appropriate, they can add flavor into a liquid medication and then maybe the patient will take it. So typically there's a reason why the patient's not taking it. We need to find out why and then document appropriately and notify someone. You should never circle a medication off more than 2 days without notifying the doctor, because we need to do something about this. It does not look good, nor is it good practice when an evaluator comes in and they see where a med has been circled off the whole month. That means the patient has not gotten this medication the whole month. We need to be investigating why and following up and intervening appropriately. The right to be educated. Patients do have a right to be educated, and a patient or a family member, so any individual or guardian, has a right to know why the medication is being prescribed, the action of the medication, and any side effects of the medication, as well as any changes to the medication itself. It is their legal right to know. Now, that does not mean that you have to quote the drug book to your patient. What this particularly means is that it can be something as simple as, Mr. John, this is your tramadol and it's for your back pain. You let them know the medication and you let them know what it was for. You could also say, sometimes this medication causes you to be a little bit sleepy. So if that happens, that's normal. And what we'll go ahead and do is you might want to lay down and get some rest after you take this medication. That's simple education right there. Keep in mind that patients also get used to how their medication looks. So if the manufacturer has changed the look of a pill or the doctor changed the dosage of a pill, the pill could have been blue last week and now it's green this week. Some patients are going to notice that. So it's good that you alert them early on. Mr. John, now last week your pill was green because it was 50 milligrams. This week is blue because it's 100 milligrams, because they get used to the way the medicine looks. They may not be able to tell you the name, but they'll say, I take a little blue pill. So keep those things like that in mind. Chemical versus brand name. We're not going to get a lot into this topic. What I will say is chemical name, it identifies the chemical components of a medication. So let's take, for instance, Tylenol. The chemical components in Tylenol is acetaminophen. That's the chemical compound that makes up that particular drug. The generic name is the common name given before the trade name is adopted. So we have to keep those in mind. With that being said, if you look on pages 46, it gives you the brand name versus generic name. This is a page to keep handy because you never know how the doctor's going to write the prescription. He might write for Demerol or he might write for Meropenem. They're the same thing. He might write for Duragesic or they might write for fentanyl. It's the same drug. So have a drug book handy or again refer to pages 46. It gives you some common brand name and generic names. Now, the list on page 46 are scheduled drugs, which typically these are the drugs that you're going to be locked under a double locking system. So keep those things like that in mind. Also on page 47, you have a trade name and a brand name as well. And these are psychotropic drugs, and they usually affect the central nervous system. So these include your anti-anxiety drugs, your anticonvulsants or your seizure drugs, your antidepressant drugs as well. So those are things to keep in mind. And that's really the difference between the brand and the chemical. As far as you're concerned, you just need to have a resource handy so you can look up a med to see, is it the brand or chemical, or is it the same, or is it two different drugs. So keep that in mind. Controlled substances. We touched on this a minute ago, but how do you store controlled substances? And this should be stored in a double lock system. So you may have a cabinet that's locked, and then inside that cabinet is a lock box. That is a double lock system, and that's how all of your controlled substances should be stored. You should also keep what we call a drug count log. This should also be kept with that particular drug so that we know when a drug was taken out, when a drug was put back, and so forth. It helps us keep up to when a drug was given. So again, if you refer to page 44 in your packet, that's an example of a drug count log. From this particular example, the count started off with 9. We thought we took one out, but we replaced one, so the drug count is still 9. We need to make sure that we go over this every shift change. Whenever you pass the keys off to the next person coming on, you should always count your meds. It doesn't matter if you didn't take any drugs out of that box or not. You still need to count those medications. Also, when you have controlled substances that are no longer in use, say for instance the doctor DC the medicine, these need to be returned back to pharmacy. You should not have drugs in a home that are not being used. For one, it could result in med errors because if somebody sees it in a drawer, they may accidentally pick it up. For two, it gives you a diversion issue, which means people could be taking the medication because the patients don't need it right now. So it's like free drugs there in the drawer. And then for three, you don't want any residents to have access to medications that they're not taking. So again, if a med has been discontinued, get it out the home, return it to the pharmacist. Return it to the pharmacy. And again, I'm just going to reinforce again, do the drug count logs every shift. Always count before you give someone the keys. Because say if I was on my shift and I didn't count with the next shift. Well, let's say third shift then found a med error. Well, it's going to be put on second shift because they're the last person with the keys. So do not pass off your keys until you have did a complete count. Verbal orders. Does your agency allow you to take verbal orders? And the answer is no. Again, what you want to do is if you call your doctor and you're reporting that your patient's having headaches and your doctor wants to give you an order for medicine, you should have them fax or call that medication into the pharmacy. When you get the medication from the pharmacy, that becomes your order that you're going to write on the MAR. But you should only do that once you have the medication in hand because you are not allowed to take verbal orders. PRN. PRN medications mean you take when needed or when necessary. And these typically can refer to prescription or over-the-counter meds. And it applies to medication that can be taken if the individual has symptoms that cannot be relieved, or if they have symptoms that can be relieved by medication. Usually the patient has to request it, and the medication aid or whoever's given the medication cannot make a judgment call. PRN medications are not like scheduled medications where you can give an hour before and an hour after. So let's say our patient has Tylenol. They can have it every 6 hours. Let's say we give it at 10 a.m. and at 12 they're still hurting. We cannot give Tylenol again until 2. So we don't have that. We cannot give Tylenol again until 4 because we said every 6 hours. So we don't have that hour before or hour after window when it comes to PRN medications. So again, keep that in mind. Also, with your PRNs, you record them on the back of the MAR anytime that you give them, and you also record the effect. So earlier we were talking about the example of the Darvocet on the back of the MAR on pages 42 and 43. Again, they wrote that they gave it, they wrote why they gave it, the route that they gave it, and they followed up to see if it was effective. Typically, after you give a pain medicine or any PRN, you want to follow up with at least an hour to see how they tolerated it. And then if you noticing that your patient really is not tolerating it well, they still have a high level of pain after they take the medicine, you do want to report that to the physician. Okay, so let's say your client is going away for the weekend and they're obviously going to need to take their medications with them. What is the proper procedure for when a resident is away from the facility? If the resident is going to miss one dose of medicine, we can send that with the resident. We can send that one pill with the resident. If the resident is going to miss multiple doses, you have two options. You can either get with the pharmacy and have the pharmacy package you up just enough meds to take with you, or that the patient can take with them on their trip, or you can send your house supplies. Either way, you have to write down the instructions for the family. On the MAR, you're going to make a note that the patient was gone with the family during this time frame. Family was instructed to give medications as prescribed. You're also going to record how much you send out with the resident, and you're also going to record how much you get back when the resident returns. If you take more than one dose out of the package itself, it's going to be considered dispensing, and that's illegal. That's out of your scope of practice. You do not take pills and send them off with a patient. You don't take individual doses and make up a dose. You have to send one particular pill or send your whole house stock. That is very important to keep in mind. And again, we do want to educate our families on how to give a medicine, what it's used for, what time they're going to get it. So if you have any questions about this, make sure you get with your supervisor to go over this again, because you do not want to be dispensing medications. It's out of your scope of practice. What are some tips that are important to remember for medication administration? Some of these tips are that we want to abide by the 8 rights of medication administration. If you abide by these rights, you should have little to no medication errors, because you're checking and you're double checking to make sure that you are given medications like you were instructed to do. So that is very, very important to keep in mind. You always double check and you avoid shortcuts. In the long run, this could cause a lot of issues if you try to avoid shortcuts. Say, for instance, you have 2 patients and you're going to prepare their meds at the same time. That's dangerous, because you could easily get those meds mixed up, and then you're going to have a medication error. So whereas you were trying to save time, you actually have more time because now you have more paperwork to fill out. Never mind the fact that you're probably going to get a coaching session by doing that from your supervisor. Keep in mind that you should always wash your hands before and after giving medications. It's the most effective way to prevent infection and cross-contamination. If you were to make a medication error, the first thing you do is make sure that your patient is safe. You want to complete an incident report. You want to notify your supervisor and the patient's physician and family as well. So let's say, for instance, I gave this patient blood pressure medicine and they don't have ordered blood pressure medication. I would want to make sure that my patient's not dizzy. I would want to make sure that they're not having any side effects, because that could drop their blood pressure. So they may have some fainting or dizzy spells on you. I'm going to do my incident report, notify my supervisor, notify the legal guardian if there is one, as well as notify the doctor. And the doctor's probably going to order that we check that patient's blood pressure. And that may be something that you have to call your supervisor to do, or even take the patient to their doctor to be checked. Documentation is very important. If you do not document it, it was not done. So you never document for someone else. Let's say somebody forgot on their shift to document. It's not your responsibility to document that the medication was given. You should definitely let that person know you left a hole here in the MAR, and then it's up to them to get with their supervisor and rectify that situation. But you do have to document what you give. You never administer a medication that you are unsure of what it is or how it should be given. You want to always ask for clarification. So if somebody wrote something on your MAR and you cannot read it, you definitely want to get with your supervisor and figure out, how can we fix this situation? What is this order supposed to be? Because you don't want to give it off. You don't want to give a medication based off what you think the MAR says. That's going to lead to a medication error. And remember, when it's all said and done, you are responsible for the medications in which you administer. It's your responsibility. That's why it's important that you use all the resources that we talked about, that you call your doctor or your supervisor if you have any questions. And just that you remember, again, I can't stress it enough, you are responsible for what you give. This concludes the lecture section of this course. Now, what I want you to do is turn to your packets and focus on pages 21 through 40. This section actually walks you through how to properly administer medications. And from a checkoff perspective, you may have to check off on oral medications that you administer, administering eye drops, nasal sprays, as well as patches. So you really need to focus on these skills, but in the setting that you work in, you may have to give any of these particular medications. So you really need to pay attention to pages 21 through 40. It walks you through step-by-step detail on how to administer certain type of medications. Whenever you do your skills check off, this is what I'm checking for. Did you do these steps? Did you do them in this order? Did you wash your hands? Did you maintain patient safety? Did you abide by all of your rights? So it is important that you really read through this section. You probably also want to get with a partner and practice these skills. And then when it's time for your skills check off, you should be ready to check off on this information. Also, hopefully you have reviewed the packet in detail and you have written any questions that you may have out to the side. When we have our face-to-face meeting, I'll be happy to answer any of these questions. If you have any immediate need, you can get with your supervisor and they can contact me via phone or email for any particular questions that cannot wait till our face-to-face meeting. This concludes your lecture section. Again, please take the time to review through your packet in detail, write down any questions that you may have. Thank you.